Hello everyone, again this is Ju Chen. I'm sorry that I put my PowerPoint in two parts of the video because if I put all of the PowerPoint in one video, that will be too long to upload on the YouTube. Okay, now let me review what I said at the last part. First, I introduced the history of the ventilator and compare what's a traditional mode and the advanced mode. And then I talk about the NAVA mechanism. So let me review the NAVA mechanism. As we know, all muscles include the diaphragm and other respiratory muscle generate electrical activity to exercise the muscle contraction. The electrical activity of the diaphragm is captured by an esophageal calendar with an attack electrode error. And signal is filtered in several steps and provide the input for control of the respiratory assist delivered by the ventilator. That's what the NAVA work. Then I want to talk about the calendar verification. We can look at that here have the P wave and the QRS wave present on the top of the lid, and the P wave disappear on the lower lid and with the decrease of the QRS amplitude on the lower lid. So we can see that the QRS amplitude will decrease and the P wave is disappear. When an edit waveform is present, observe which leads are highlighted in the blue, like this. And secure the edit calendar in this position. It means we put the edit calendar in the right way. To finally verify the correct position of the edit calendar, pressure the expiratory hold and keep the button depressed until a breathing effort is registered. A negative deflection in the pressure curve with a simultaneous positive inflection in the edit curve verify correct position of the edit calendar. And how to set the NAVA level? NAVA preview is a help tool to set the NAVA level to reach the estimate NAVA. On the uppermost waveform, the pressure curve, there are two curves present simultaneously. There are two waveforms, this one and this one. The gray curve shows the estimate pressure and based on the edit signal and the set NAVA level. NAVA preview is available in all invasive mode of the ventilation except NAVA. And what we have to setting on the ventilator when we use the NAVA? Basic we have to set the NAVA level, and then we have to set the PEEP, of course, O2, trigger, pressure support. It depends on you use the volume control, pressure control, or pressure support mode. And we also have to the cycle and the pressure above PEEP. So in conclusion, there are basic settings we have to do: NAVA level, PEEP, O2, and trigger and edit. And we also have to set the cycle and the pressure support, and we also have to set the backup ventilation when we use the pressure support. And then we just need to select the accept and then setting and process with NAVA ventilation will be done. And how does NAVA work? First, we are talking about the cycle, how to trigger the NAVA. This is the signal. We can see that on the waveform, the ED signal. And then at the same time, the patient can trigger the ventilator immediately, give the patient a support pressure. That means patient don't need to make their effort to trigger, like by the pressure trigger or the flow trigger, to get the pressure support. And then the ED also present the signal that the pressure is not enough. So when not sure that the pressure is not enough, the pressure will assist pressure proportional to ED. And then when will the ED make the pressure breathe cycle off? When the flow drop until when the peak ED drop until 70% of the preset, there will be cycle off. So what is the benefit for the NAVA? First, the most important one is to improve patients' ventilator synchronize. We also can reduce patients' work of breath, maintains lung protective tidal volume, and eliminated main sleep disturbance, and adapt to alert metabolic demand with the consistent unloading, and also can prevent the tissue's atrophy. It may improve the patient's blood gas. And it's more safety for the patient. It can reduce the ventilator association lung injury. It can less hemodynamic compromise. It also can make more effectively to the VQ match. An ED signal analyze may provide predictive indicate for the success of the extubate, so it can have the more repeat winning rate. There has also have the video to talk about how benefit of the NAVA. The synchronize will be redefined. NAVA can give the best synchronize with the ventilator and the patient. And it's a safeguard to your patient's respiratory drive. So it's also can use for the baby. It can use in the NICU, for the adult, by the invasive or non-invasive. So babies can wean themselves on the NAVA. It's also on the adult. As I say, it's only can use on the ventilator, the servo eye ventilator, but it can provide the non-invasive and invasive, both type of the ventilator. So at the non-invasive part, it's the same, synchronized redefinition. But we have to think about that. When we put a tube into the nasal, it's also one of the invasive procedure. Okay. So let me make a conclusion. The most important thing for the NAVA is monitoring. Indeed, is the gold standard for the identify patient's ventilator asynchronized. Trigger is the most important part. And the NAVA provide improved and safer ventilation. But we still need to do more research on this new mode because we're not used to use it on the clinical, so we have lack clinical experience. As for me, I never use that in the clinical, so I put a clinical training for here to remind everyone. Clinical training not only for the RT, also for the nurse, physician, any other clinician. NAVA is a new mode. When we want to use on the patient, we should pay more attention on that, and we should get more study, and then we can put on the patient. Try our best to put on the patient. So this is my reference, and thanks for your listening.